Across Norfolk and Waveney, we're keen to understand what we can do to help people with learning disabilities and autism live longer and healthier lives. Norfolk and Waveney Integrated Care Board have led a series of reviews that look into learning why people with a learning disability have died, which has provided data and information for the annual report. These reviews have been supported by organisations across the health and care sector. 72 reviews were completed. We found that the average age of death for a person with a learning disability or autism is 60 years old. Most of these people died in a hospital, and the most common cause of death was pneumonia, which is an infection in the lungs, and the second most common was cancer. We found that 48% of all deaths could have been avoided or treated. The avoidable death rate for the general population is 22%. From the completed reviews, the overall experience of care and service availability was less than satisfactory. We're pleased to say that more people are having their annual health check, but we've also identified that more people need to have a health action plan. The report found we were successful in supporting people to have their COVID-19 and flu vaccinations. However, only 13% of people eligible for the pneumonia vaccine had had it, and we need to improve this. There are some great examples of services adapting their care and making reasonable adjustments. These examples include using hospital passports, allocating side rooms, adapting communication tools, and encouraging parents, carers, and familiar staff to attend appointments. Services could also improve on providing reasonable adjustments. They could undertake further preparation ahead of tests, introduce more equipment into acute settings, ensure only small groups of ward staff are working with a person to help build trust, request specialist learning disability nurse support, and query missed screening appointments. We also want people to have a better choice about where they live, and the care they experience should be good quality wherever they are. The Mental Capacity Act needs to be used better in hospitals to make sure appropriate decisions about patient care are made. Decisions about people's care also need to be better recorded. We've also learnt about the importance of learning disability and autism teams in hospitals who train staff and support patients. We are working harder to support people with poor mental health to prevent them from needing to go to hospital, and we review patients in secure hospitals regularly. We need to support more people to attend their cancer screening appointments, especially breast and cervical cancer screenings. And we need better care coordination to support people with multiple health conditions. Staff in supported living or care homes need more training. GP practices and residential homes need to encourage patients to do more exercise, eat better, and maintain a healthy weight. Services could also improve on reviewing medication and ensuring medications are given for the right reasons. We will continue to complete quality reviews as fast as possible while working with key partners. Raising awareness of our work is also important. We're also aiming to increase referrals for people with autism who have died to help us analyse data in the future. Our learning interaction work will also continue, which aims to improve the life expectancy and care quality for people with learning disabilities and autism. The full annual report is available on our website. If you have a learning disability or autism, we want you to tell us about your own lived experience. Get in touch with us using the details on the screen.